Rhinoplasty, sometimes referred to as nose reshaping, can enhance facial harmony and the proportions of your nose. Dr. Anil Punjabi, a plastic surgeon at Redlands Community Hospital, talks about some common reasons why someone would want to have rhinoplasty performed.
The most common reason for doing a rhinoplasty is to make the nose smaller. Most patients come to us complaining of a bump on the nose. A lot of these patients also have problems with breathing. So rhinoplasty is one of those procedures which are not only aesthetic but also functional.
Dr. Punjabi explains how a rhinoplasty procedure is performed.
What we alter during the rhinoplasty is actually the framework. The framework of the nose consists of the upper portion, which is the bone, the bony bridge, and the lower portion, which is the cartilage. When we reduce or we reshape or we sculpt the nose, we alter the bone and the cartilage in order to give form and function to the nose. The surgery can be done in a closed fashion, which we call a closed rhinoplasty, where all the incisions are located inside the nostrils, or it can be done open, where those same internal incisions are combined with a small incision that goes across the base of the nose. That's known as an open rhinoplasty. When we do this surgery, most of the times we do it with magnification. Sometimes we use an endoscope, and the surgery usually is performed with treating the cartilage and the bone and reducing the size, reshaping them, and sometimes we have to narrow these structures in order to give a pleasing result. So sometimes we have to actually do osteotomies or breaking the bone so as to narrow the size of the nose.
The doctor discusses the recovery time for a rhinoplasty procedure.
The procedure is about 3 to 4 hours, and the recovery time from this procedure is about 1 to 2 weeks, depending on how extensive the surgery was. Most of the times, the patients are surprised at the lack of pain. They will be bruised, they may have swelling, they most of the times comment that they look worse than they actually feel. They're able to resume their activities as soon as the next day. They can go out and be back at work within usually about a week to 10 days. Many times these surgeries are partially or completely covered by insurance.
Dr. Punjabi discusses the satisfaction of being able to help these patients.
Rhinoplasty is one of the most challenging but yet one of the most satisfying procedures. When you can change the proportion and the profile of the nose, it can significantly improve the self-confidence and appearance of a person. Just to see the look and to see the gratification and the happiness that patients feel on this so-called unveiling of their new self is astonishing. It is a very meticulous procedure, but yet it is also very rewarding.